Hi there, this is Nursing Education Videos. Today I will be reading Hypermagnesemia, Magnesemia, Hypermagnesium, Hypermagnesemia? Alright, I googled it. It's Hypermagnesemia. So today I will be reading Hypermagnesemia NCLEX review on registerdnursRN.com. All credit for this information that I am reading goes to Sarah at registerdnursRN.com. All credit for the information that I am reading, again, goes to registerdnursRN.com. Please refer to the websites in the description box for all credit and information. Disclaimer from registerdnursRN.com. This video is for educational purposes only and is not intended as medical advice. While we strive for 100% accuracy, errors may occur and medications or protocols may change over time. Hypermagnesemia NCLEX review notes. Are you studying hypermagnesemia and need to know some mnemonics on how to remember the causes, signs and symptoms, and nursing interventions? This article will give you some clever mnemonics on how to remember hypermagnesemia for nursing lecture exams and NCLEX. In addition, you will learn how to differentiate hypomagnesemia from hypermagnesemia. Don't forget to take the Hypomagnesemia and Hypermagnesemia quiz. In this article, you will learn normal magnesium levels, causes of hypermagnesemia, signs and symptoms of hypermagnesemia, nursing interventions for hypermagnesemia. Okay, so hyper means excessive. Magnese is the prefix for magnesium. Emia is blood. Meaning of hypermagnesemia is high levels of magnesium in the blood. Normal levels of magnesium is 1.6 to 2.6 milligrams per deciliter. Greater than 2.6 is considered hypermagnesemia. Magnesium plays a role in major cell functions like transferring and storing energy, regulation of parathyroid hormone PTH, which also plays a role in calcium levels. In severe cases of hypermagnesemia, the release of calcium is inhibited because the PTH is suppressed. And that is why you see hypocalcemia if you have a severely high magnesium level is present. Magnesium also plays a role in the metabolism of carbohydrates, lipids, and proteins, and blood pressure regulation. Magnesium is absorbed in the small intestine and excreted via the kidneys. Any issues with these systems can cause magnesium level issues. Causes of hypermagnesemia. Remember mnemonic MAG, M-A-G. Hypermagnesemia is less common than hypomagnesemia. It typically happens when you are trying to correct hypomagnesemia with magnesium sulfate IV infusion. However, other causes can include magnesium containing antacids and laxatives such as Mylanta and Maalox, Addison's disease, which is adrenal insufficiency, glomerular filtration insufficiency, less than 30 mils per minute, which is considered renal failure. This is because the kidneys are keeping too much magnesium. This is the GFR, the glomerular filtration rate. So it is less than 30 mils per minute, which says here renal failure. A quick Google search brought up On kidney.org, a kidney failure would be indicated by a GFR, so a glomerular filtration rate below 15. On registerednursRN.com, the statement here is glomerular filtration insufficiency, brackets less than 30 milliliters per minute, and then bracket again, renal failure. This is because the kidneys are keeping too much magnesium. Signs and symptoms of hypermagnesemia. Remember, every system of the body is lethargic, opposite of hypomagnesemia, where the body systems are experiencing hyper excitability. So in a situation where the body has too much magnesium, the body becomes lethargic. And if there's no magnesium, the body systems experience hyper excitability. Note, you would typically only see symptoms in severe cases of hypermagnesemia, where the mild cases patients would be asymptomatic. So the mnemonic for the signs and symptoms is lethargic, L for lethargy, which is profound, E for EKG or ECG changes with prolonged PR intervals and with prolonged PR and QT intervals and widened QRS complex. T for tendon reflexes, absent/grossly diminished. H for hypotension. A for arrhythmias, bradycardia, and heart blocks. R for respiratory arrest. G for GI issues such as nausea and vomiting. I for impaired breathing due to skeletal weakness. C for cardiac arrest. Nursing interventions for hypermagnesemia is monitor cardiac, respiratory, neurosystem, renal status. Put patient on cardiac monitor and watch for any EKG or the other name ECG changes. Ensure safety due to lethargic/drowsiness. And prevention. Avoid giving magnesium containing antacids/laxative to patients with renal failure. Assess for hypermagnesemia during IV infusions of magnesium sulfate for hypomagnesemia. Signs and symptoms would be diminished/absent deep tendon reflexes. 3. Withhold foods high in magnesium, such as, this is the mnemonic, always get plenty of foods containing large numbers of magnesium. So these are the foods to avoid: avocado, green leafy vegetables, peanut butter, potatoes, pork, oatmeal, fish, canned white tuna/mackerel, cauliflower, dark chocolate, legumes, nuts, oranges, milk. Administer diuretics that waste magnesium if patient is not in renal failure, such as loop and thiazide diuretics. Patient in renal failure, if patient is in renal failure, prep patient for dialysis. IV calcium may be ordered to reverse side effects of magnesium. Watch for IV infiltration, and preferably IV calcium would be given through a central line. There is a quiz on registerednursRN.com on hypomagnesemia and hypermagnesemia. hope this information was helpful and engaging. Please feel free to subscribe and click the like button and go to registerednursern.com for more information.